5 shots to get while on prednisone, plus which ones to avoid. I'm Dr. Megan, the Prednisone Pharmacist. I'm here to share with you the latest information straight from a Harvard rheumatology professor about what vaccines you need to get while taking prednisone to protect your immune system. This is especially important right now while there's a measles outbreak that could be harmful for people taking prednisone. So this professor gave this presentation at Harvard Medical School, and I was lucky enough to attend this seminar. And she went through infection prevention measures, and some of the most important are vaccines. There are a few more that I'll mention at the end as a little bonus. So let's talk about why do we care about vaccines when it comes to prednisone? Because I know vaccines are a very controversial topic that some people get really emotional about. But when it comes to prednisone, it's really an important topic to talk with your doctor about. And that is because prednisone is used on purpose to turn down your immune system. That's why it's there for a lot of people. People who are getting a kidney transplant use prednisone to turn down their immune system so they don't reject their brand new kidney. People who have autoimmune conditions turn down their immune system so that it stops doing the bad thing it was doing. For example, I took prednisone for a condition called ITP, and my immune system was attacking my own blood cells called platelets, leading to an increased risk for bleeding. It was horrible, and prednisone made it so I wasn't going to die. So it's used on purpose for this effect. But that means it's leading to an increased risk for actual infections. When we're turning down our immune system, there's not as much of an army to fight against infections. So what are the actual risks? They did a study looking at claims information from both a Medicare population and a private pay Optum population for those who took prednisone at some period of time and then had a hospitalized infection, not just like a runny nose. They were hospitalized. That's how bad the infection was, okay? And then they stratified it by what dose, whether it was below 5 milligrams a day, between 5 and up to 10 milligrams a day, and 10 milligrams and above. So those 3 were the main doses that they were looking at. And in that situation, even less than 5 milligrams, like this is nearly nothing compared to what your body naturally makes. Just taking prednisone alone increased the risk to 1.34 to 1.35 as a hazard ratio. This is saying you have a 34 to 35% increased risk for an infection, even at less than 5 milligrams a day. And the incidence over a year, like if you were taking less than 5 milligrams for a whole year, your chance of getting an infection was 5.2% if you were younger, like on that private insurance company, and then 11% if you were 65 and up using Medicare. Then from 5 to 10 milligrams, it was 1.86 to 2.17. So you were like 2 times more likely to get an infection compared to people who don't take prednisone, with an incidence over the year of 8 to 14%. So that's between 5 to 10 milligrams. And then 10 milligrams and above, it's a 3 times greater risk, from 3.36 to 3.27. And the incidence was between 10% and 17.7%. So that's a lot of people who can get hospitalized for an infection. And there's a lot more people who are sick but didn't have to get hospitalized. So I want you to understand that the risk for being sick is quite high when you're on prednisone, even at low doses. And what makes this whole conversation a little complicated that I want to acknowledge at the very beginning is that taking prednisone and other glucocorticoids decreases your actual response to vaccines. One study they did in a condition called lupus showed that for those who had lupus but didn't take prednisone, compared to those who have lupus and take prednisone, there was a 75% decrease in the ability to respond to a vaccine. So even if you get a vaccine, it's not going to work as well for you as for other people, which is unfortunate. And that was specifically a study in the COVID vaccine. Okay, so let's get to the 5 vaccines people on prednisone should use to prevent complications and infections that can lead to hospitalization, ICU stays, and death. All right. So the number 1 is a flu shot. And the hard thing about a flu shot is they have to guess up to 6 months in advance of what it's going to look like. They have to use the infections on the other side of the globe to predict what it's going to look like by the time it gets to us. And they can guess right and they can guess wrong. And so some years it's a really good match, and other years, like this year, not so good match. But getting a flu shot reduces your doctor visit by 40%, death by 31%, and ICU stay by 26%. All of those are fantastic. I do not want to die of a flu. So when I take prednisone, even when I don't take prednisone, I get my flu shot. Next is RSV. So this is a new one. This is pretty cool. My babies have all gotten RSV at some point. The younger they were, the worse it was. It was horrible for some of my babies. I have a nephew who was in the ICU with RSV. That's respiratory syncytial virus, and it kills babies. Like, this is a virus that kills babies. But what a lot of people don't know is that it also kills old people. It's just people either don't get tested for it or just aren't aware that it does kill older people as well. And so it's definitely recommended in pregnant women who are between 32 and 36 weeks gestation. My sister recently got it for her baby. So good, protecting her baby. But it's also recommended in every single older person older than 75 years old. And if you're 60 years old and older and you're at an increased risk. If you're taking prednisone, you're at an increased risk. So if you're over the age of 60, you should be getting your RSV vaccine. Make sure you've got that to cover you. And what it does is it reduces your RSV-associated hospitalization by 75%. That's amazing. Number 3 is the SARS-CoV-2 immunization, and getting that 1 to 2 times per year, depending on how bad your immunosuppression is. The CDC recommends every 6 months. And again, this one's also tricky to predict how effective it's going to be for the currently circulating virus, but it has been shown to decrease hospitalizations and to prevent death in those of us who are immunosuppressed. All right, number 4, Shingrix. Shingrix helps prevent shingles, or what used to be chickenpox, erupting, coming out because you are immunosuppressed. It's recommended in all adults over the age of 50 and any adult from 19 to 50 and above who is immunosuppressed. And it is 90% effective at preventing a shingles eruption. And for those of you who've had shingles, you know how horrific it is. There's these big, huge pustules that'll show up like a part of your skin, and they're painful. Like, people will just go naked for days because they can't handle just the texture of their shirt touching it. It's so painful. So this is amazing. One shot to prevent 90% of the chance of getting that. Like, easy, hands down, do it. Get your Shingrix. Then number 5 is PCV20 or Prevnar 20. This is a pneumonia vaccine. It's an encapsulated virus that is going to prevent most of the pneumonia types of things that you would get while taking prednisone. Between the flu, RSV, and Prevnar, those 3 are going to cover most types of pneumonia that you would get that would hospitalize you with prednisone. And because pneumonia is one of the most likely causes of death in people who take prednisone. So those 3 are going to protect you from those most likely causes of death. So those are the 5 that you should get. What are some that you might have questions about or that are a little more controversial? So I'm going to talk about those that you should avoid. And I have a whole video all about more that you can avoid, but I'm going to just briefly mention a few. You should avoid the other shingles shot. So the one I specifically recommended was Shingrix, but there's another one called Zostavax, which is a live vaccine, which is not recommended because you don't have an immune system able to deal with a live vaccine. Essentially, live vaccines are not safe for people on prednisone. So avoid those. And then that leads us to MMR vaccines. Now, this is important because of the measles outbreak right now. You might be concerned, yikes, I am immunosuppressed. Am I going to get the measles? Am I going to die? What do I do? And this is technically a live vaccine, and live vaccines are usually not a good idea on prednisone. So what do you do? Well, there's a few steps you can take. You can figure out whether you're presumed immune, whether you have presumptive immunity. If you were born before 1957, the doctors just assume you probably got measles as a child. If you've had both, like 2 MMR vaccines in your lifetime, like you're up to date on your vaccines, then you're presumed immune. And then if you get a titer, if they like test your blood to see, do you have an immune response to the measles? In those 3 cases, they assume that you have immunity. But what if you only got 1 vaccine? What if you've never gotten a vaccine? What should you do? You should definitely talk to your doctor, because live vaccines are not usually safe while you're on prednisone. And if you are going to get a booster of an MMR, you need to have no immunosuppression for 1 month. So that means no prednisone for a month, no other drugs, whether it's an injection or a pill, for a month before you take that. And that's, for a lot of people, not even a possibility. So you really got to talk to your doctor, figure out the best strategy for you. And then the Harvard professor also recommended other age-appropriate vaccines. And then I also promised other infection prevention strategies. So if you are the type of person who would qualify for the COVID prevention medication called pemivibart, which is also called Pemgarda, then definitely talk to your doctor about that. See if you qualify and get it, because we don't want you getting COVID. If you're taking prednisone, you have worse outcomes. Okay, the second one is, what if you haven't gotten your shingles vaccine and someone near you either got chickenpox or shingles? Like a family member has shingles and you're wondering, what do I do? It is possible to worsen your chance for getting an eruption of shingles. And so in that case, you could do prevention medication with an antiviral like valacyclovir, 1 gram 3 times a day. That's a possibility. You can talk to your doctor and you do that for 20 days. But it all depends between you and your doctor whether that's a good idea. And then there's a third type of infection that can lead to pneumonia that is really a lot more common in people who have HIV immunosuppression. And it's kind of been this controversial thing. It's called pneumocystis jirovecii pneumonia, PJP. And it used to have a different acronym, but we're just going to call it PJP right now. And they used to say, oh, you need to be, if you're taking 20 milligrams or more of prednisone per day, you need to be taking an antibiotic to prevent your chance of getting this. And a recent study just came out like yesterday about your dose of prednisone and how much worse chance you are of getting this infection. And it showed that in order to prevent 1 infection, you would have to treat 117 people with this antibiotic called Bactrim or SMZ-TMP or sulfamethoxazole, trimethoprim, whatever you want to call it. It's an antibiotic that I'm personally allergic to and a lot of other people are allergic to. And so taking an allergy-promoting antibiotic is a bad idea generally. And 69 people had like really bad reactions to being on an antibiotic. 2 of whom got Stevens-Johnson syndrome, which is where like your whole body can anyway, it's bad. So I say the number needed to treat does not overcome the number needed to harm. To simplify that, unless you have other bad things going on, like you had a kidney transplant or you have really bad lung disease or something, taking this antibiotic to prevent a PJP infection, I don't recommend. And this Harvard professor said it's not necessary unless you have high risk for PJP. So those are the infection prevention things you need to know. And then if there are other things you would like to know about preventing complications, because taking prednisone, you have a higher risk for bone loss, cardiovascular disease, eye complications, and so on, up to 150 different side effects. I created the Prednisone Checklist, which includes the things you need to do to prevent complications. So click the link below to download it now so you know exactly what you can do to minimize your complications of taking prednisone. Signing off is Dr. Megan, your prednisone pharmacist.